the hospital service and clinic service relating to patient health and medical care are usually based on paper-based records. And electronic health record system actually is to use the ICT technology to try to use digitalized data and make it an electronic form. And this is very useful because electronic medical record stored in a digital form can be analyzed, stored, and retrieved at a faster rate, and also at a more accurate and completeness, so that it will influence a lot on healthcare delivery. Well, the concept of electronic health record is more than a medical record or a clinic record. Basically, it can also include those activities like lifestyle habits, like what the patient and the people is doing in their daily living, like amount of exercise, how many diets they consume, and also what are their own home blood pressure and sugar monitoring data, etc. So all in all, is actually the whole data related to the health of a patient. Usually the term EHR or electronic health record system is our way to go across the world. Every country is aiming to get a countrywide EHR database so that the patients could be offered the best healthcare delivery. The government can know the health status of the citizen and to help them to devise the development of healthcare system and to audit and monitor healthcare deliveries. So actually most countries are investing quite a lot into making this EHR a reality for all their citizens. Yes, actually there's multiple factors that may pose as a very important barrier and pose a lot of challenges in adopting a successful EHR system in any country. You are quite right that technical is not the only factor. In fact, it is mainly a human factor. However, technically, there is also some bearing. You require the technical infrastructure, like every clinic and a hospital has to be equipped with an automated computerized system. And yes, you know, a lot of countries, particularly in private solo clinics, the adoption of IT in this clinic is not high at all. And so you have to have the technical infrastructure that will incur quite a lot of budget constraints. You need funding, resources, and investments. Otherwise, the technical side is quite easy to get through. And the second barrier will be on the concern of privacy. Patient confidentiality in their health data are regarded as a very important privacy matter. So we have to use technical means to try to secure and ensure that the data will not be leaked out to unauthorized access. And however, the major obstacle is to make a EHR successful, it has to be a very interoperable system, meaning the public has to be shared with the private sector and different private institutions has to be sharing the data related to a certain person. And this interoperability is not easy to achieve, particularly for countries or regions where different hospitals and clinics are using a different system. There will be a problem of data standards, problem of different machine interface, different kind of data flow. Although many machines claim they are open system, but in fact you have to do a lot of efforts to try to convert them into a really interoperable data. So I think this is a matter of change management and also the attitude that really make a successful EHR quite difficult in a lot of countries.